in the stomach primarily, we have hydrochloric acid, as well as the enzymes from our saliva. So this is not really hydrochloric acid, but as a demonstration, let's say this was hydrochloric acid. Who wants to come up and have me drop some of this on your hand? And no volunteers. Why is that? Why don't you want hydrochloric acid on your skin? It's acid. It will eat through your skin, right? It's because hydrochloric acid burns a hole. It breaks down protein bonds. This is just water, actually. But it does look like it could be hydrochloric acid because it's very clear. Hydrochloric acid breaks down protein bonds, and so the food that we eat that has protein in it is broken down into smaller pieces with the hydrochloric acid. Hydrochloric acid also kills bacteria and viruses because it breaks down their outer protective layers. And so our digestive system is also a key component of our immune system. Many people forget that's the case. All right, and so if you deacidify your stomach too much, like if you think you have too much stomach acid and you're taking a lot of antacids, then actually you could be damaging your digestive system, not breaking down your proteins sufficiently, and then having difficulty getting the proteins in your body that you need to build muscle mass. So antacids are sometimes quite inappropriate for an individual because it can deacidify the stomach. Also, anyone ever heard of Tums? All right, it's a calcium carbonate. And Tums had to reinvent itself a while back because there are so many pharmaceutical medications that were dealing with the hydrogen proton blockers for ulcers and things like that. And so a lot of OB/GYN offices have these posters on the wall that say, eat Tums to get your calcium. Well, Tums is not really a good form of calcium. It's not well absorbed, and it deacidifies the stomach. So not only, and you know, it's calcium carbonate in general is not a good form of calcium. It's not well absorbed, and it deacidifies the stomach. So you might actually be taking something of that nature thinking it's going to be really helpful for you. And you do want to take things into your body that are helpful. However, that actually deacidifies the stomach and can create more problems and not actually get the calcium into the bones that you want there anyway. So the stomach churns, breaks down the proteins, kills off bacteria and virus as much as it can, and then it passes in the small intestine where the pancreas and the gallbladder shoot various enzymes, bile salts, and things in to help break down fats, to help break down carbohydrates, other enzymes that also help to break down proteins as well. And so in the small intestine, this food that's all being broken down should be broken down hopefully into smaller pieces, into smaller amino acid complexes versus a large protein, into smaller parts of sugar and fats, fatty acids, versus these really huge globs. And that is where the nutrients are absorbed into our bloodstream, hopefully, in the small intestine. The large intestine takes extra water out of the remains that go down, and then we all know what happens when it comes out into the toilet. So there are other organs besides the ones we just mentioned that assist the digestive system. Those include the tongue, salivary glands, the pancreas, which produces enzymes, and also sodium bicarbonate that helps to deacidify the hydrochloric acid from the stomach so that you don't burn a hole in your small intestine. And the gallbladder, which also stores the bile salts and the bile that comes from the liver. And the bile salts are somewhat like a soap. Everyone know what soap does? Right? What's it do?
Bubbles up.
It bubbles up, yeah. Soaps bubble up, and it takes fat and it breaks it into smaller pieces, so it's easier to clean up, for example, clean off of a dirty dish or something like that. So it's easier for water to do its job by breaking down the fats into smaller little pieces. And that's what our bile also does for us. The digestive system performs two vital roles, which I've been reviewing here already. It breaks down food into absorbable nutrients like vitamins and minerals, to be transferred into the bloodstream and utilized by the body. Number two, it protects the body from harmful substances which can cause disease or infection. So let's look at the most common digestive complaints. Acid reflux. There are other names that are used, acid indigestion or heartburn. It's one of the most common forms of digestive problems, and it affects as many as 61 million Americans. Acid reflux manifests itself as a burning sensation in the chest that often moves up the throat and neck and can be caused by a variety of lifestyle factors. That includes stress, dietary habits, caffeine, well, bad dietary habits, or eating your food really fast, not chewing it well, not breaking it down in smaller pieces, too much coffee, alcohol, nicotine consumption, and the use of certain pain medications that can cause this acid reflux as well. Hiatal hernia. I'm sure many people have heard of that. And this is a condition in which the stomach pushes up into the chest through the diaphragm at the esophagus. Our esophagus connects from the mouth, goes down between the lungs, and it goes into the abdominal cavity. So our diaphragm is right here under the rib cage. That helps us breathe. It isolates the lungs and the heart from the abdominal cavity. So there's a hole there for the tube to go down through. That's where the hiatal area is. So the stomach can sometimes push up, and the contents of the stomach can push and create pressure against that hole through the diaphragm, and then sometimes you can get the contents of the stomach going up a little bit into the esophagus, and because the esophagus was not made to have all that extra acid in it, then you can get this burning sensation. So you can get the burning sensation, and the acid being pushed back up can also cause inflammation of the esophagus. Now, occasionally this will eventually lead to esophageal cancer as well, as if it goes on too long, because there's an erosion of the tissues of the esophagus. Hiatal hernias generally affect people over age of 50. Nevertheless, all age groups are susceptible to this. And hiatal hernias are primarily caused by severe coughing, vomiting, straining, and sudden physical exertion. We have a few new extra guests here this evening, and so if you could just pass the lecture notes back to them, I'd appreciate that. Right now we're just going through and reviewing a number of different digestive disorders and what they're like, what the symptoms are like, and what causes them, typically. Irritable bowel syndrome, also called IBS. This is an intestinal disorder thought to be caused primarily by stress and or diet. It results in cramps, abdominal pain, constipation, and or diarrhea. It affects up to 15% of all Americans. So that's quite a prevalent digestive disorder. And according to the Journal of the Royal College of Physicians, 63% of chronic fatigue sufferers also are diagnosed with irritable bowel syndrome. So there's a connection there between chronic fatigue and IBS. We also have stomach and peptic ulcers are in this list. How many people know someone or have this particular condition themselves? Raise your hand, please. I want to make sure that we cover if you know, we can get through this sufficiently for it. Ulcers affect about 1 in 10 Americans. That's quite a number of people. So there were maybe, let's see, there's 5, there's 12 people in here. 2 people raise their hands. There we have it. 1 in 12, 2 in 12. Of the 5 million people diagnosed with ulcers each year, 40,000 of them end up in surgery. And as many as 6,000 of those die due to ulcer-related complications. And typically that's bleeding. Ulcers are open sores or lesions found in the stomach or the small intestine. So there can be 2 primary locations. Symptoms include a gnawing or burning pain in the abdomen, nausea, vomiting, loss of appetite or weight, and fatigue. And some of the fatigue may also be due to some of the blood loss that's going on. Factors in the development of ulcers include diet, dietary factors, stress, medications. There are a variety of NSAIDs, which are the non-steroidal anti-inflammatories that can cause ulcers and bleeding, which is one of the reasons why one has to be very careful if you have chronic pain as far as the amounts of these medications you're taking. And alcohol and tobacco use can also be related to stomach and peptic ulcers. Let's talk about diarrhea, everyone's favorite subject. Diarrhea may be either acute, meaning just sudden and for a short time, or chronic, something lasting long. And it can be triggered by one or more conditions. These can include an infection somewhere in the intestinal tract. Food allergies could be gluten sensitivities, tomato, eggplant, corn, or a variety of other types of foods. It can be due to stress or reaction to medications as well. The symptoms of diarrhea include, of course, has everyone in this audience ever had diarrhea at least once? Raise your hands. 100%. All right. 100% of people in this audience have at some point in their life had diarrhea. Probably you may have had it when you were an infant as well, because as an infant, and I see a lot of children in my practice, infants start out, the digestive system isn't very well developed. It hasn't, it's just all mother's blood and everything that is its nourishment, and then all of a sudden it's coming out, and each of us went through this, of course, right? We're all like older than infants, and so we each had to go through it. Food versus mother's milk or formula, and then something else new introduced, something else new, and the digestive system going, wow, what's this? And the immune system going, wow, what's this? Hey, is this something I can deal with or not? And so again, it's our digestion, absorbing nutrients, as well as the immune system involved in our digestive system. The small intestine and the large intestine compose 60% of our immune system. It's because they are dealing with stuff from the outside going inside. And the inside of the intestine is this warm, dark, nutrient-rich, very, very nice area that is very conducive for the growth of bacteria and fungus and other things. Each of us naturally, when an examination of the stool is done, if they look for all the critters in there, there's approximately 450 or 500 different species of bacteria, fungus, viruses, and other things in there, small critters, that occupy all of our insides. How many do you think are on your skin? A lot, right? The skin is a barrier to protect us from things we don't want to get in our bloodstream. The skin here turns into our mouth and our lips, right? Turns into the lining of our esophagus, the lining of our stomach, lining of the small intestine, lining of the large intestine, and it comes out the other end at the anus, and it turns back into the skin here. It's all one giant protective barrier.